Hello, everyone, and welcome back to the podcast. I'm your host, Samara. Today, we are discussing a diagnosis that often causes a great deal of confusion and, quite frankly, fear. We are talking about schizoaffective disorder. When people hear that word, they often feel completely overwhelmed. It is a complex condition that sits at the intersection of mood disorders and schizophrenia. To help us untangle exactly what this diagnosis means, how it differs from severe bipolar disorder, and why there is so much hope for treatment, we are joined by our resident clinical psychologist and author, Dr. Laura. Welcome back to the show.
Thank you for having me, Samara. I am so glad we are devoting an episode to this. You are absolutely right. The name alone can be terrifying for patients and their families because of the heavy stigma society places on it. But once you break down the clinical facts, it becomes much easier to understand and, most importantly, to manage.
Let's start right at the foundation. Dr. Laura, what exactly is schizoaffective disorder?
The simplest way to understand it is to think of it as a hybrid condition. Schizoaffective disorder is essentially a combination of two different illnesses happening at the same time. A patient experiences the symptoms of a mood disorder, like the severe highs and lows of bipolar disorder or major depression, combined with the psychotic symptoms of schizophrenia, such as hallucinations or delusions.
Okay, so a patient is dealing with mood swings, plus things like hearing voices or having fixed false beliefs. But here's the big question that I see constantly in our community. How is that different from bipolar 1 with psychotic features? Don't people with severe bipolar also experience psychosis?
That is the crucial question, and the difference all comes down to timing. Yes, a person with bipolar 1 can experience psychosis, but that psychosis only ever happens during an extreme mood episode. If they are severely manic or deeply depressed, they might hallucinate. But once their mood stabilizes, the psychosis completely goes away. In schizoaffective disorder, the psychosis operates independently of the mood swings. To receive this diagnosis, a patient must experience psychotic symptoms for at least 2 solid weeks when their mood is completely normal and stable. So, they aren't manic, they aren't depressed, but they are still experiencing hallucinations or delusions. That is the key clinical difference.
Wow, that is such a clear distinction. The psychosis continues even when the emotional pendulum is standing perfectly still. That must be incredibly exhausting for the patient to navigate.
It is deeply exhausting. It can feel like you are fighting a battle on 2 completely different fronts. But that is exactly why getting the correct diagnosis is so vital. If a doctor thinks it is just bipolar 1, they might only prescribe a mood stabilizer. But for schizoaffective disorder, the treatment plan has to target both fronts simultaneously to give the patient relief.
Let's talk about that relief. For someone listening who has just received this diagnosis, what does the treatment actually look like? Is long-term stability possible?
Long-term stability is absolutely possible. Please do not view this diagnosis as a life sentence of suffering. Treatment usually involves a carefully tailored combination of medications, typically a mood stabilizer or antidepressant, to manage the emotional swings, paired with an antipsychotic medication to quiet the hallucinations and delusions. When you combine the right medication with targeted psychotherapy, people with schizoaffective disorder can and do live rich, fulfilling, and highly functional lives.
That is the exact message of hope we need. It is a complex condition, but it is highly treatable when you have the right medical map. Thank you so much for breaking this down so clearly, Dr. Laura. If you want to dive deeper into the specific criteria for this condition and learn more about treatment options, please click the link in our show notes to read the full article at bipolar-lives.com. And if this episode brought you some clarity and peace of mind today, please take a second to like our channel and subscribe. It really helps us continue to bring you expert-backed, stigma-free mental health content. I'm Samara. Thank you so much for listening, and we will see you in the next episode.